years,
of
Shaw & Associates has been your trusted experts for wealth management, tax, accounting, and payroll. We change lives and inspire true wealth, one person, one family, one business at a time. Shaw & Associates is a wealth management investment firm that specializes in taxes, serving as a fiduciary, putting your interests first. You can find more information or schedule an appointment by calling 530-674-1150 or on the web at shawassociatesinc.com. Shaw & Associates is proud to support community radio.
We're grateful for the support from Shaw, and also, if you'd like to support community radio, just go to 93qradio.com and hit that donate button. This morning, I have some great folks from Peachtree Health. Notice I didn't say Harmony. I did. I knew I'd get it right. Michelle Woodard, right? Tracie Riggs, and Dr. Kalpas. Gosh. Anyway,
good
so
to see you, Fish. How are you doing?
Good. You guys doing good this morning?
Doing great. I got my coffee. We're ready to go.
Oh, yeah. You know, I can't move without the coffee. Without the coffee, I'm dead in the water, right? So I asked these great people to be on here for a reason. I had an opportunity to meet Dr. Kalpas at an event. And sometimes I just feel like we really, you know, you end up with a doctor of healthcare and you don't even really know them. You're just going in for whatever. And then eventually, if you're, you know, with them long enough, you get to know them. So I thought I'd give people an opportunity to get to know you first, right? So, Michelle, what do you do again? Tell me
I'm the Chief Operations Officer.
Operations Officer. Mm-hmm. I'm going to get this. I will. And Tracie?
Yes, I am the Chief Executive Officer.
So, Doc, you brought the people that run everything.
I brought the A-team today.
I'm telling you, you didn't.
I don't mess around.
Oh, no kidding, right? You know, and then so I wish what I'd like to do is explain to me a little bit about how the process works with going to Peachtree Health, because you know I'm familiar with if I go to emergency room and urgent care, whatever. Can you tell me a little bit about Peachtree?
Yeah, where should we start? So Peachtree Health is a federally qualified health center, which means we're a community health center focused on whole person care and serving our community. So we do everything from medical, behavior health, dental, vision,
chiropractic, acupuncture, pediatrics. We cover a little bit of everything. We try to keep as much as we can in our four walls. Yeah.
Well, you did tell me off air, which I didn't know. I thought you only had one location. Yeah. I was all excited. I'll go out and take a camera, right? You got four?
Yeah. We did start with the Linda Clinic. We were originally in the old mall, which is now Costco.
Wow.
And we were part of Fremont Rideout Health Group when it was the hospital system in town. So we were a satellite clinic from there.
You guys have been around a long time.
We have. We've been around a long time.
But not you personally.
Well, yes, actually I have been since the beginning, since we were part of the hospital. I was there in the beginning. So, yeah.
Michelle will celebrate 35 years with Peachtree Health this November.
So I'm assuming you guys have a great retirement plan.
We're working on that.
So if I go to work there, I'm already 76. Can I get my retirement retroactive?
Absolutely. Yes.
I'll be over tomorrow.
Okay.
I'll sign it up. I don't even care what I do. And so this is really cool because I know that there is a lot more involved in than I just go to work. You guys connect with people, patients. Doc, I'm sure you got patients you've seen multiple times, and I hope it's okay to say you, Doc. Once I got chewed out because I'm military, right? I've always been, so I just called him Doc, right? And he said, "How disrespectful can you be?" And I went, "Well, what am I supposed to call him?" And said, "Doctor." Oh, doctor.
I was Army, so you can call me Doc. So.
Come on, Doc. We understand, right? And it's like, how did you get involved in this? When, you know, as far as...
Yeah. So one of my priorities in my career is to really serve underserved populations. And so, I've worked in the VA, and I've worked in different clinics and hospital systems, but I was really drawn drawn to community health centers because we see all patients, no matter how much money you have, no matter the color of your skin, your sexual orientation, doesn't matter. We see all patients, no matter whether you have money or not, or where you're from. We see all patients. And so it's really, in a way, a safety net that if you can't get health care through your employer or through the VA or some other way, we'll see you no matter what.
Man, I love that. I have VA health, and I know some people complain about it, but my wife and I, we're both Vietnam vets, and man, we've been treated exceptionally well.
I love the VA. Yeah, it's a great system because it's a really well integrated system, right? You got the primary care, the inpatient all together, and they really work together well.
Yeah, the only thing I don't like is I have to go to either Mather or, because we have a clinic here now, but I got to go to Chico or Mather for major stuff, and they're talking about changing that, and so I hope that happens, or that we get more facilities, because if I could just run down and see you guys for something, easy breezy, right? You know?
Yeah, we're here locally, so we can see you, and even if you go to the VA, we can also see you as well, and we can work collaboratively with them as a team.
Yeah, my doctor will do that. He'll like, I met a doctor I interviewed here, and he explained some things to me about my feet, why they hurt all the time. And so I went to my doctor and I said, hey, I want to see this guy. He signed me off to go do it, and I went and saw him. We have so many incredible healthcare people in our area. There's a lot, and yet at the same time, it's not enough, is it?
It's not, because the underserved population is so large in our Yuba County areas, Yuba-Sutter County. It's always a challenge to get enough providers, recruited to our areas. And we work very closely with the other FQs in the community so that we can share in the responsibility of serving that population that really needs us the most. As you mentioned, Dr. Kalpas, the safety net, that's really what we're all about.
But a lot of people don't know about us, and we do have availability to see patients sometimes in a couple days, and we treat all kinds of diseases or conditions, whether it's physical, diabetes or high blood pressure, or you need colon cancer screening like we talked about last time, or if you need treatment for substance use disorder, or just dealing with stress in life, or you need your teeth cleaned, or you got a kid that needs their vaccines. We've got all types of different services that people might not know that we provide, including treatment for HIV, screening for HIV, all kinds of things that we can really help keep people healthy or get them healthy again once they are sick.
That's a huge undertaking. Kudos to you guys. That's a lot. And it's right here in our community, available. What did you call it? The underserved? Tell me again. What is it?
Yeah, the underserved population.
Yeah, what is that? Explain that to me.
They don't have health coverage, maybe through Blue Cross or something like they have a managed care plan, or they don't have any health coverage. They don't qualify.
So somebody that doesn't have anything at all. They don't have, and they don't have a nickel in their pocket.
Yeah. So we have what we call a sliding fee program. So you come in and you have no way to pay or very limited means. We base that on some certain demographics, and we see you.
Man.
If we can get you qualified for Medi-Cal or another service, we will do that also.
Tracie, is that common that people that actually could have health care, Medicare or something, and they don't have it because they don't know?
Yes, it's very common. We actually do care navigation or care coordination. So we have eligibility screeners who come in and will help pair resources with individuals. So we sit down with you, we find out all of your information, and we start working both with county, state, and federal resources to see what you might be eligible for. But that's the beauty of a community health center too, is we don't turn anyone away. So it doesn't matter what the issue is, when you come in, you will be seen.
Man, I love you guys. I'm community radio. We love community stuff like that. This is awesome. How come this is the thing. Doing what I do, I find out new stuff all the time. And that's one of the reasons I really wanted you guys to come in, is because I knew I didn't know. Right? And I want people to know what's available in our community. And I love, Doc, what you said about, look, we're not trying to screen you for who you are. We're trying to keep you healthy. And so you may have wrecked your own life but we're still going to help you. I just, yeah, I love that because underserved. I'm going to have to try to grab hold of that. They tell me that people are food something. And I say, you mean hungry? It's like, I get that. I understand that. So do we have a very large population of that in our area? Is there a lot of people that they don't have health care, or maybe they could have it and don't know it?
Absolutely. We actually see around 45,000 patients a year.
Wow.
Around 120,000 patient visits a year, around there. So we're seeing a lot of people and doing a lot of good.
So is it the same in all 4 areas? I mean, do you guys have to CEO all 4 areas? And COO all 4 areas?
Yeah.
Huh?
Yes, we oversee. When
All
you
of
say
it.
all areas, yeah. So, I mean, what's the beauty of the community health centers is, like Ed said, we see 174,000 visits last year.
Gosh.
Majority of those will fall in that Medicare, Medi-Cal range, which means those are the underserved that Michelle was pointing out. And the beauty of community health centers also with the care coordination is healthcare in the United States is complex and it's not easy.
Yeah,
We help to break
yeah.
that down from the moment you call and get on the phone with one of our call center customer service reps to the point you get in to see a medical provider. It's breaking that step by step, that process down for people, even if it's in getting into specialty care. All of that happens from the point that they call the front desk, and then we begin working with you to get you into the door. Or if they show up at the door as
Right.
well, we get you in.
Man, I
And
love
providing
it.
them the language they need. That's often a barrier to care, but we provide, we have translation for every language that you could possibly think of.
What
And-
about if they speak Brooklyn?
Well,
That
I was
too.
We
born
work
in
through
Brooklyn.
that, too.
I worked through this. I've learned to speak
Yeah.
Californian.
one of our great services we provide that we didn't mention at all was vision services. So eye care that we have at most of our clinics, and then a standalone up in Chico. And I've been there when children have come in with their parents,
yeah.
and I think of a young boy walking out and putting his glasses on for the first time and saying, "Oh my gosh, Mom, I can see." Hadn't been able to see the chalkboard, hadn't been able to see, and he was like 9 years old. So that's why we do this work.
No.
It's because of the great things that happen every day in our clinics.
And we're growing too. I think I said we saw 120,000, but that was the previous year's data. Like Tracie said, we're actually over 170,000 visits last year. So we're hiring more doctors, we're hiring more physician assistants, we're hiring more nurse practitioners. So if you or anyone out listening knows any great doctors that want to really help people that really need that help, get them in contact with me and we'll interview them.
So your job is not just as a physician.
Yeah, I'm the chief medical officer, so
Okay,
I
tell me
oversee
what that is.
I oversee all the clinical aspects of our clinics. So, oversee the doctors and providers, work on policies, workflows, quality improvement, really keeping our patients healthy, keeping our providers happy and healthy as well. So, really making sure that all the clinical aspects run smoothly.
Man, I like this. That's one of the reasons I wanted you guys on, so people could be able to understand Peachtree Health has got so much to offer. Today I found out you got 4 locations. Who knew, right? I just thought there was one, and then I find out that you guys are willing. You just want to keep people healthy.
Yeah,
You just want to help people that are sick get well, and I think that at the core, I'm very grateful for the doctors that I've had during the course of my life that I've been able to sit down with and say, look, this is where I'm at. What can you do? I had cancer on my vocal cords, which for me is everything I do is talk. And I had this great doctor, and he sat down with me and he said, there's different treatments. He said, but I can see it. It's on your vocal cords. If you'll let me, I'll go in and take it out. And because your vocal cords are really thin, it took 7 operations. But the whole time I'm having this conversation with him, he understood where I was at. He knew absolutely, right? And it's like, I'm a pastor. So many times I've had people come to my office and say, Pastor Bob, I got cancer. But it's way different when you're the guy sitting on the other side and the doctor tells you that.
Yeah, Absolutely.
You move from compassion to empathy, right? And I felt like, honestly, Doc, when I first met you up there, I thought, this guy cares. It's
Thank
not
you.
just a job to him, he cares. And now I've met you gals, and I think your whole office cares. you guys are going to get the I Care Award,
Yeah.
man.
That's why we do this
amazing.
every day.
And
Yeah,
how many years?
In November, it'll be 35.
You realize you're never going to retire. You like your job too much.
Well,
That's our
that's
hope.
what they keep telling me, that I'm not going to retire.
They don't want to lose you. They want to keep you there as part of the deal. Tracie, how long have you been with Peach?
I've been with Peach for about 18 months.
Wow, so you're new.
I'm a newbie,
You're the new
yes.
kid on the block.
Yes, our most of our executive team, Michelle is the glue that keeps us together.
Wow.
Has been with us almost a year, and our chief financial officer has been about 18 months or so. Yeah, so
Wow.
we're all fairly new to the team, and Michelle has been the glue for the organization. Obviously, with 35 years experience, but also the historian for us as well.
So I just want to do this, and that is, so we've talked a little bit. I want people to know who you are. So what would you like people to know? What would you like them to know? This is who we are as, as the business side, the professional side. What would you like them to know? Go ahead.
If you're looking for a provider, doctor, therapist, psychiatrist, whatever, that really listens and cares about you as a patient, schedule an appointment with us, and we'll get you taken care of and really make sure that you get the best care possible, because that's what we're really committed to, that no matter who you are, that you deserve the best health care possible.
Gosh darn, how come I never heard of you guys? I did one time. So, Tracie?
I think my first thing is what you said, is we care. We are a family-first organization that starts with our team first, and we continue building out there till we get to the team, to the family of our patients. And we care. We care from the moment you call in to the moment you leave your appointment to making sure you get back in. And it's every part of that person and the whole person care that we provide.
Well, ditto. It's really from the time you walk in our clinics and that experience starts, you will find that because our employees are happy and we are family first, that radiates to the care we give back. And it is all about your family when you come through our clinic and whole person care.
Guys, I appreciate you taking the time to be on, and we've talked, we're going to do a podcast later, get a little deeper into, really there is that side where there are those personal stories of success. We don't have time to cover them, but you guys have all experienced them. Like you said, the little boy, all of a sudden they can see. And I just think that I want people to understand what is available. I didn't even know we had this. I didn't know we had a medical facility or facilities, right? Organization that, man, it just doesn't matter. You need help, come here, we're going to help you. I just think that's awesome. So
yeah, people can go to our website, pickpeach.org, and they can get more information there.
Who did that? Pickpeach.org. I love
It's perfect, huh?
Well, I tell people, people are driving when they're listening to this. You come up with something simple like,
I can't forget
they
that,
can
right?
remember
Pick
that,
Peach.
right? Pickpeach.org. Well, thanks so much for coming on. I appreciate it, for you guys for taking the time. And for more information, go to pickpeach.org and ask for any of them to explain it to you. They're there for you.
Well, thanks for having us on, Fish.
Thank you so much.
This community interview is made possible by Shaw and Associates.
I'm Dave Shaw, President and CEO of Shaw & Associates. For over 70 years, Shaw & Associates has been your trusted experts for wealth management, tax, accounting, and payroll.